So we've covered an abstract summarizing our data, our internal data at UT Southwestern. I'm presenting this on behalf of one of my residents, Dr. Marissa Komitas, who is the first author on this abstract, summarizing the efficacy of Luspatercept for patients with lower risk MDS. So we looked at our internal data and had 37 patients treated with Luspatercept over a 4-year period from 2020 to 2023, and looked at the 2018 IWG response criteria and in what line of setting was Luspatercept used. So we had 37 patients that were treated with Luspatercept, and 31 were evaluable for response assessments because they were on Luspatercept for 16 weeks or longer per the IWG 2018 criteria. The median age at Luspatercept received was 74, which is pretty average or typical for patients with lower risk MDS. What's interesting is in our cohort, about 20% of patients had had prior hypomethylating agent therapy, about 14% had had Lenalidomide therapy, and so this is not necessarily the population that were treated on the commands in the MEDALIST trial that led to its approval. In our cohort of patients, the median duration of response was 48 weeks, and interestingly, this was longer, although it was used in the second line or greater therapy, this was longer than what was reported in the MEDALIST study. Also interesting enough, about 22% of patients who responded initially lost the response, and half of those regained response with increasing doses of Luspatercept and escalating to 1.33 or 1.75 milligram per kilogram dosing. And so from our study, I think I would highlight a couple of points, is that escalating Luspatercept doses is quite important when we use this agent in patients with lower risk MDS, and bigger studies are really needed to better understand its role, particularly in the post-HMA setting or post-lenalidomide setting.